Asthma. Okay, let's just hop right in. Asthma is chronic and it causes the airways in the lungs to become inflamed and narrow. So, asthma obviously affects the respiratory system. These airways are the bronchi and the bronchioles, specifically, what we're going to talk about. And asthma is recurrent and treatable. Here's some anatomy. The visual on the right is just lungs overall. We're going to be looking at the two pictures on the left. So, as you can see, the normal bronchiole, that is healthy, that looks good. Whereas on the right, if you can see on the outside of the bronchiole, I don't think we can I use a laser? Oh, yeah. All right. So, all this, those are on the outside. Those muscles are contracting. And then on top of that, these inside muscles are inflamed. And this is like the mucosal, they say. And then inside that, there's this mucus. And usually there's, a little bit of mucus in here. And its job is to sort of remove things like dust particles and whatnot. Whereas someone with asthma, especially during an asthma attack, which we'll talk about, this mucus is no longer helpful and just clogs the airway. Here are just some stats. I'm not going to read them off. Just know asthma is pretty common and causes a lot of hospital visits in children, probably just because they have not been diagnosed yet and don't have access to treatment. These are signs and symptoms of asthma. 1 to 2 of these being experienced at a time might happen just like day to day during regular activity in someone with asthma. But when there's multiple symptoms, that is getting closer to an asthma attack, especially something like wheezing, chest tightness, tripoding, hyperinflation, which is an excess of air in the lungs. It's easier to inhale than exhale when you have asthma, and especially when you're struggling to catch your breath, that shortness of breath feeling. But yeah, it can cause a whole bunch of things. Shoot, you can see my laser. Anyways. Okay, so on to asthma attacks. 3 things happen, which I sort of showed in that picture earlier. So bronchospasms is when that muscle on the outside of the airway constricts, and then inside the lining of the airway becomes inflamed, and then the body creates more mucus. Jeez. Okay. So things like allergens, exercise, irritants, infections, weather, stress, even things like fragrances can all cause an asthma attack. Also, something like elevation. So, treatment on, we'll get into wilderness treatment, but basic treatment, real world, day to day: sit straight, try to stay calm, take a puff of a rescue inhaler every 30 to 60 seconds, up to 10 times, and use a spacer. I'll show you what a spacer is. Call 911 if you don't have an inhaler or if you feel worse. All right, let's talk about treatments, starting with the big one, which are inhalers. There's 2 main types of inhalers. There are long-term daily inhalers. They are inhaled corticosteroid inhalers. So these are taken as like a preventative measure. There's a bunch of different brands. They look different, but they all do the same way. And basically, the medicine just goes into the lungs and prevents further swelling. There are also preventative oral medications for asthma, which are less common. A rescue inhaler, which you may know as albuterol. These are those emergency rescue inhalers where it quickly tries to reduce the airway sensitivity. Also, other treatments, just being mindful of irritants, using a humidifier, steam therapy. All right, this is how to use an inhaler. Shake it. This is a medicine that sort of can separate in its little vial. So you shake it. You use a spacer. So this thing, you connect this blue part to your inhaler. You put your mouth to this part, and basically what the spacer does is it just dilutes the medicine in here before entering your lungs, so the medicine can be more evenly distributed in your lungs. Inhale slowly, deeply, hold for 10 seconds, and then repeat. This will depend on the person, their age, their severity of asthma, and whatever their doctor recommends. Okay, 3 levels of severity: minor, moderate, severe. Pretty self-explanatory, just something as a guideline. We talk about that ability to count to 10 or say like a certain amount of words in a certain amount of seconds. So if they can count to 10 in one breath, they're good. 6 to 9, they're all right. They might be experiencing some sort of asthmatic event. And then severe, this is an asthma attack. And we talk about that hyperinflation again, or we see that. And they can be experiencing shock at this state as well, and probably anxious because they feel like they are going to pass out or won't be able to breathe. Okay, this is what to do as a woofer. And I'm going to read this pretty close, word for word. Place patient in position of comfort, so sitting or standing, but it's usually going to be sitting. Make sure to fully take a history, medication list, and allergy list. Make sure you can rule out anaphylaxis. Encourage pursed lip breathing. This encourages the bronchioles to open. If the patient has a rescue inhaler, assist them in using it. You can choose to help the patient breathing by assisting their exhale. This is kind of an old school way of doing it, but as they exhale, have the patient lie down, place your hands on the sides of their rib cage, and as they exhale, gently compress the chest wall, so put pressure. And as they inhale, keep holding the chest wall compressed and maintain compression as they exhale and inhale for 3 cycles. And then after the 3rd cycle, release. Sorry, I didn't know this was repeated on my slide. This can be repeated as often as needed to aid in getting out that trapped air. And you're going to want to consider evacuation depending on where you are, if they have these incidences often, age, whatever. It's up to you. So these are some considerations: altitude and cold air, limited access, evacuation challenges. Say you're leading a trip and you know you have asthmatic people, especially kids, just reminding them to use inhalers when exercising. Cardio can be really tough for asthmatics, and taking breaks. When to evacuate. No relief from inhalers, signs of hypoxia, they can't speak full words, changes in LOC, and then noisy or silent breathing that worsens. Sweet.